Hi, this video is all about meniscus tears and how you deal with them and going from being in pain to getting back doing your running or your sport. We're going to cover quite a bit in this video. We're going to go through a little bit on the anatomy. We're going to go through the mechanism of injury. We're going to talk about how can a meniscus injury heal without surgery. We're going to talk about all the treatment options that are available to you. We'll go through recovery times and some general advice, and then we will move into the rehabilitation exercises that you need to do throughout all the stages. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Lucan in Dublin. So if we look at the model of the knee here, this is the meniscus here. So you've got your tibia and you've got your femur. The meniscus sits here and its function really is force transmission, but also shock absorption. So it is that little bit of cushioning in between these two bones here. So you've got a meniscus on both sides of the knee. Now, generally, the mechanism of injury and what a meniscus doesn't like is a rotation force like this, or if there's a deep flexion position like this, you can get little tears in the meniscus. And the tears can happen anywhere, on the inside and the outside. They can happen horizontally or vertically. There are some tears where it folds back on itself, called a bucket handle tear. They can be a little bit more challenging. But a long time ago, or years ago, when I was studying this initially, a lot of the approach was to get surgery done. But to be honest with you, that has all changed now, and there's loads of studies that have followed up on people who have had both surgical approach and a non-surgical approach. And certainly at 2 years, you cannot say that surgery was any better. And if you think back to this being shock absorber, if the surgery involves knitting it together or cutting a little bit of it out, you have less cushioning and support there. So down the road, it can be a little bit of a predictor of future problems if you go with the surgical route. But you really, for the 99% of the time, you do not need surgery to get this sorted. This can all be solved with the right approach, which we are going to go through here. But in terms of injuring it itself, you might have noticed your foot being stuck in the ground and you rotate like this. So it could be that sort of a rotation injury and you feel a sharp pain, or it could be down into very deep flexion. So if you're squatting very, very deep, or even, to be honest with you, there's age-related changes that happen over time. It doesn't have to be a traumatic event. You could be doing a bit of work and down on your hunkers like this quite a bit, and you gradually start to annoy your knee to the point where it becomes really problematic. So down in this position here, there's a lot of grinding through here. So people with manual jobs, or if you are doing housework or doing something around the house and you're down in this position, you can make your knee sore, and you're certainly a little bit more vulnerable to that happening as you get older, or if you're, I suppose, not active at all and you've no strength base there and you go into those positions. So in terms of can a meniscus injury heal? Well, here's the thing, the actual issue itself doesn't heal. There's no blood supply to the meniscus. But here's the thing, it actually doesn't have to heal in order for you to get out of pain and get back to full function. So, pain can be very complicated. You can have a meniscus injury and not have any pain at all. And also, generally they're diagnosed by an MRI scan. Sorry, they don't need to be, they're diagnosed clinically, but people often get an MRI scan and it shows it. But you can have patients who have a different knee injury and they get MRI scans and it shows an old meniscus tear, but they've never had surgery or they've never had pain in that meniscus tear. So what the research shows us is that you can have a meniscus tear and have pain, and you can have a meniscus tear and have absolutely no pain. So we don't need that to change in order for you to get back to yourself. So yeah, so to be honest with you, can it heal? No, but you don't need it to heal in order to get to full function. I hope that makes sense. We've spoken a little bit about the treatment options. The vast majority of the approach now with most surgeons is or should be non-surgical, but that's not to say that there aren't instances where you do need surgery, and some candidates or some people will respond better to surgery. So if, for example, you are still struggling 6 or 8 weeks after the initial pain and struggling to function, struggling to walk, lost range of motion with no real trajectory of improvement, That might be to the point where, you know, you're moving like this, and if something flicks off your toe, you're in incredible pain and discomfort. If it's like that at 6 or 8 weeks, with you having done the right things up to that point, well then absolutely you could be a candidate for surgery. But for the vast majority of people, it's not needed. So if you go down that route, you generally rest, you stop, you wait for an appointment, you're falling into that sort of pain, rest, weakness spiral. And then you actually like lose capacity in around your knee and your leg and the muscles around the area. You've stopped being active, so maybe you're a runner or sports person, and it's unnecessary few months, to be honest with you. So hopefully at the end of this video you'll be able to handle this a little bit better yourself. It's not that you have to wait for someone to fix this for you. It involves doing the right things. So let's move on to then recovery times and general advice. So on that, the recovery times vary. It's very difficult for me to give an exact thing there. It varies dependent on the exact type of tear, the location of the tear, and the extent of the tear. It also depends on the person. How sensitized and sore are they? What are their activity levels? How do they interpret the injury? Does it really bother them every day? Are they taken away from their sport or activity, which is their identity? Is it affecting their sleep? And there can be a little bit of a spiral of increased sensitivity and pain there. Do they have a belief in, actually, I want to do the right things and get this better again and do exercises and help myself? Or have they, you know, low self-efficacy and they just feel they can't do anything and they don't know what to do? So there's lots of factors that contribute to the pain. But for the most part, to be honest with you, if you do the right things over a 12-week period, you should be going from not being able to run to being back running. Let's have that as a general guideline. But in that, you also need to do the right things. We are going to go through some rehabilitation exercises from when it's very, very sore and sensitized to when it's not near as sore and you're able for a lot more. But if you choose the wrong intensity of rehab exercise, then it's not going to work for you. So as we move on, we will be holding a weight in our hands and doing some loaded knee dominant lunges. If you do that in the first few weeks when it's too sore, that's absolutely the wrong thing to do. We might start off with you literally just gently trying to move your knee. And that's absolutely fine and the right thing to do for the first maybe week or so. But if you're still doing that at 5 weeks, that's a complete waste of time as well. So I hope that makes sense. In that time as well, what I would really recommend is you try where possible to avoid the two mechanisms of injury that really annoy this initially. So that position where your foot is in the ground and you're rotating. So it might mean you have to stop doing your sport or you try not to get stuck or caught in these positions. That could happen if you're stepping down off a step and you go to turn, it will really annoy you. So you have to be conscious of that. And also if you're down, you know, changing a child's nappy and you're down in this position, or you're doing a little bit of work on a skirting board and you're down here like this, that will absolutely annoy you. Now, to be honest with you, even 3 months later, I wouldn't be looking for trouble like that. I would, if you have to do something like that and this is the injured knee, I would still probably try and adapt and do that rather than being down here, because like prolonged time there could still sort of annoy it. You'll get back to the stage where you can do all of that, but I wouldn't be going looking for it. So I hope that makes sense. Okay, so we've gone through the anatomy, the mechanism of injury, whether a meniscus can heal or not, which it can, the best treatment options, and non-surgical approach is absolutely the best one in the immediate and the long-term results there. And we've talked through some general advice. Let's now go into the rehabilitation exercises first. So if it's very, very sore initially, you might just spend time yourself loosening out the knee with a little bit of, you know, grapeseed oil, moisturizer. You can sit down and do it, and you can maybe do a little bit of just gentle movement. Getting that synovial fluid moving and pumping in around that part of the joint is what helps with the healing. So avoiding all movement is not recommended at that time early on when it's very, very sore. And remember, this can happen where there is no trauma. You could be just sitting at a child's concert in school and you're in a small chair and you're in more of this position here. Or you suddenly try a yoga class or a flexibility class when you're pushed into these positions a little bit more, and next thing your knee is in big trouble and very, very sore. So It can happen like that, but in those early stages, you just try to not annoy it. First 5 to 7 days, just get it moving gently like that. It might mean you're just gently moving it. Once you can do that, but again, that's just very early stage. Once you can do that, the next stage of exercises I would move on to would be exercises that work the hips and glutes here, that don't put the knee into a compromising position. So you can definitely feel better and get some control back when you start doing some exercises. So for example, let's take one of these bands here. So what you might do even without a band is, and you'd have to watch yourself getting up and down off the ground there, but it might just start with you being okay in this position and you're literally just doing some bridging exercises. And here in this position, maybe you're trying to squeeze and hold your hips and glutes. You feel your hamstrings and your hips working, and back down. And you might even start off with 10 or 12 repetitions of that in a set. Okay, if that's a little bit too easy and you're able for a little bit more, what you can do is go up with 2 legs and then stay like this for 5 to 10 seconds. So you're working this leg, this is the injured leg here, and back down. And if that's easy enough, you can go up and down on this side. But in this position here, what that's doing is it's working up here away from the knee itself. It's not putting the knee under any pressure, which is important in the early stages when it's quite sensitized. And also you're not bringing it into these positions here, which will annoy it. So working up around the hips and glutes, there's any number of options. You can easily just lie on your side, have the knees bent, look at your toes, and then start bringing this top leg up and down. And you can feel some work. If you do that for long enough, you'll feel some work up here along the hip. And then in the early stage as well, you could also obviously go into some calf raises. Okay, so again, if you go into a calf raise and you do some calf raises and you even hold it in this position, it's working the calf, it's also working the quad, and you're not bringing that knee into a annoyed position. So once your sensitivity or your pain allows you to do those exercises, loosen it out for 2 minutes if you need to make it feel a little bit better. Get into those exercises, maybe do 2 or 3 rounds of it. Do that every second day. That might get you through the first week or 2 weeks. And you will absolutely start feeling better by doing something as opposed to doing absolutely nothing. Let's say you go every second day and see how you tolerate that. So those initial exercises then should mean that you can move around a little bit freer and a little bit better with less pain. What we need to do then though is start moving on to more advanced exercises that work the quad muscle here a little bit more. Now, again, you cannot go down into these sort of like deeper squat positions. That will annoy it. So what we might do is go towards a wall here, and you might start off with basic wall squats. Be nice and patient, sitting back into the wall, a little bit of pressure down through your feet, and as time goes on, you'll generally start to feel a little bit of activity here. Try and get to the point where you're not annoying your knee. This isn't going to work well if you're someone who keeps trying to push it and push it and push it, especially in the early stages for the first number of weeks. And you keep annoying, you might just keep the pain alive by annoying your knee all the time. So go to a position. If you can see here at this angle, I'm not down into a vulnerable position. This might be too much for some people, so you might come up a little higher. You might be able to be a little bit lower, but in this position here, my knee is not in a compromised position. My knee isn't way forward ahead of my foot, putting the knee joint under pressure like that. I'm in this position here, and if I stay here long enough, I can start to feel some activity through here. Now, if that's too easy, what you might do is shift a little bit towards the side, bring this foot further out. Just put this for balance here. Now that changes it completely. It looks very, very simple, but as I'm here now, I can certainly feel a lot more activity through my quad muscle. And you can stay here till you feel really fatigued in your quad muscle. And then again, if that's too easy, you can lift this up all together and do a single leg one. That works here really, really well. If you add that on top of the hip and glute and calf exercises, you have a nice program that should start to make you feel a little bit stronger and stop the weakness and muscle wasting around the knee joint. Another one you can do, let's say if this is the affected leg, again trying to get this area working, is just apply a little bit of inward pressure with your foot. All of these exercises are to start bringing in muscle activity into this quad here. Again, holding it for however long, 10 or 20 seconds, take a break and repeat that. At this stage as well, you might be able to work the hamstrings a little bit easier. So
You might bring your feet out a little further. The hamstrings come down and attach below the knee, so it's important to work those. And just going up and down like that, or going into some holes here like this where you feel the hamstring muscle working. Take a little break and repeat. So if you think of the exercise we've covered at the moment, hip and glute, hamstring, calf and quad are all being worked without bringing your knee down into these sorts of awkward, deep squat positions or bringing any sort of rotation in. And those movements can improve and get less sore if you allow some time to pass by and start doing some exercises like that that don't irritate it but work the muscles around it. Moving on to more advanced exercises then, you need to put it together and start using your knees. So for example, you might even say body weight, apply downward intent through your foot, stand up tall and back down. So you're actually starting to use that leg again. If that's too easy, bringing in some weight here, pushing down through that lead leg, and that's a more knee dominant exercise that you need to be able to do. To make that more advanced, you could just increase the height of the step. You can use stairs at home, or if you're in the gym, you can do it like that. Then you also though do need to get to the stage where you are potentially lifting a little bit heavier. So if you're in this, you don't have to do this, but if you have access to it and you know how to do it, it's a good one to do. And you're actually like lifting some heavy weight, pushing your feet through the ground. That is all really good for your knee. And you need to be able to do that type of thing in order to get back running. You can't go from those earlier stages to running. Another example is this one here, holding it in this position. And then bringing in some reverse lunges. So you're going through more range of motion there with more weight. They all need to be done in order for you to get back running. Bring in plyometrics as early as possible. So if you can just do some basic jumping and landing like that, but it will need to get to the stage where you can hop 20 times on each leg with no real difference to allow you to get back jogging. So I hope that has covered enough to give you more information and more control over it. If you have any questions on this, feel free to reach out and we'll be happy to help.